Good morning, ladies and gentlemen. Thank you so much for being here. Today I would like to discuss faith in medicine. Does Chaplain Visitation improve recovery after a heart attack? Before I get too far into the presentation, my name is Blake Gibson. I'm currently pursuing a Bachelor's of Science in Biomedical Science and a BA in Spanish Literatures, Languages, and Cultures here at the university. I hope to graduate this December, and my work on this subject and the presentation today has been formulated from a variety of different experiences I've had recently, one of which at Duke Medical School on faith, medicine, and spirituality. I recently put on a symposium here on campus on the same subject, and of course the current research project. To briefly outline the things I'd like to discuss today, the first of which is terms and definitions, and this is really a thorny issue, but I hope to get us all on at least some of the same page and consensus in discussing these types of subjects. Then, to discuss religion's relevance to patients and how it might be relevant, survey current faith and med studies in both affecting mental and physical health. Since the current study we are working on is on heart attacks, so to bring in a cardiovascular connection, how do the current studies related to CVD show relevance for our study, and in the current studies' designs and methodologies? As I said before, terms and definitions are really a difficult issue. My hope is not to offend anyone here today. Certainly feel free to take or leave any of these definitions, but rigorous definitions are really necessary for scientific research, and so today I will propose a few definitions that hopefully we can get behind. But these definitions really aren't as necessary for clinical work. I would propose religion is a belief, practice, or ritual firmly rooted in the transcendent. The transcendent can be called God, Yahweh, Allah in the West, in the East, the ultimate truth, reality, enlightenment. Whatever this transcendent is, it's certainly at the core of religion. Central to that definition of religion is it's established in a group of people and generally recognized not only from within the group, but from without the group. Spirituality, however, is a much more difficult definition to pin down. It is certainly a complex and multidimensional part of the human experience. Many people find spirituality in a variety of places and ways, in fact, some of which are not even connected to a transcendence. So one feels spirituality in nature, or through music and the arts, or a set of values and principles. In fact, there's been the emergence of something called a secular spirituality, in which there is absolutely no connection to a transcendent, but rather the pursuit of scientific knowledge is a spiritual experience. To make matters worse, these definitions have not stayed put, and in fact they've changed over time. In the Middle Ages, to be religious was actually someone who was very connected through personal investment to the transcendent, where today we think of someone who is religious as someone who's part of the organized religion. So the definitions have flipped, and in this way, so has the definition of spirituality. Today, spirituality sort of carries the connotation that it's not connected with an organized religion, where in the Middle Ages, in fact, a spiritual person was someone who was solely connected with the organized religion and not necessarily on a personal level invested. So not only is consensus hard around these definitions today, but they've actually changed over time. While not the same, I will use religion and spirituality interchangeably in this presentation, not to confuse or to confound, but rather these studies that I will discuss have not specifically elucidated the difference. It's just sort of a catch-all. Whatever the patient's got is sort of what the study examines. Is religion relevant? And this is something that I think has been debated for centuries, and indeed it's hard not to look in the news and find questions related to this. Recent Gallup polls indicate that 93% of Americans believe in God or a higher power, and in fact about 7% that don't. Half of those atheists admit to praying at one time in their life. So this is really a commentary on perhaps this is a subject that continually comes to the forefront of people's minds, at least in this country. 83% of surveyed say religion is fairly or very important in their lives. Of patients surveyed, they were asked, should physicians consider a patient's spiritual needs? 77% agreed with that statement. But when asked, did the physician ever ask? Only 13% actually said this was something that was brought up. So there's a very interesting disconnect that's going on. Indeed, when MDs were in fact surveyed, should we ask about patient spirituality? 86% agreed. When asked, well, did you actually do it? Only about 9% said they actually did. So clearly we've got a disconnect between what we know is important and relevant and what we're actually doing. Sort of in the context of this relevance issue, what can spiritual or religious belief do for a patient? Well, when you look at the sociological trends of the West and America, the importance of the nuclear family and the extended family has really declined as a center for communal life. Indeed, spiritual religious communities can offer a physical and emotional infrastructure that can supplement or in some cases replace the loss of dominance that we've seen from traditional structures. So there's an important community that can be fostered through religious or spiritual belief. In addition, faith or spiritual belief can give a suffering patient the framework for meaning through something greater than oneself and a perspective as to the suffering they're currently going through. Now on to a brief survey, and this is brief. We could be here all day if I discussed every single faith and med study, but in terms of mental health, overwhelmingly, in fact, 278 out of nearly 360 studies show religious or spiritual belief to foster greater well-being and happiness. I'd like to point your attention to some very specific studies. In fact, in depression patients, they received either religious cognitive behavior therapy, secular cognitive behavior therapy, pastoral counseling, or nothing, which is the control. And only those patients receiving religious cognitive behavior therapy improved faster than the control. Very fascinating and sort of suggests not only the effectiveness of religious cognitive behavior therapy in this case, but in fact it's the most effective method. Sort of related to this study, in generalized anxiety of patients whom were Muslim, and this was actually done in Indonesia, they were given religious cognitive behavior therapy in addition to standard treatment of benzodiazepines and or supportive psychotherapy and or relaxation exercises. And only those religious patients receiving the religious cognitive behavior therapy improved faster than the religious controls. In fact, religious attendance has been associated with a slower progression of cognitive impairment and also a slower progression of Alzheimer's disease. Now on to the sort of physical aspects of the current faith and med research that's out there. 7 out of 7 studies have shown an increased immune or endocrine function as a result of faith or spiritual belief, lower mortality from cancer, less heart disease, lower cholesterol, lower overall mortality. And in particular, this test paper caught my eye. Increased serum interleukin-6 levels in breast cancer patients were correlated with church attendance. And IL-6 levels are sort of a gross indicator of one's immune function, and so if you've increased the ability of the immune system to function, that could mean potentially better recovery and better outcomes for these breast cancer patients.